Your Excellency, Mrs. Amina Garib Hakim, President of the Republic of Mauritius. Your Excellency, Mr. Pile Vayapuri, Vice President of the Republic of Mauritius. Honorable colleague ministers from Mauritius and from the African region as well. Mr. Frank Istangenberg, Chairman of the Board of Trustees of MERCK Foundation. Dr. Rasha Khalej, CEO of MERCK Foundation. Distinguished guests, ladies and gentlemen. To begin with, I would like to personally welcome you, each and every one of you, to Mauritius. It's a great honor and a privilege for me to have with us today distinguished ministers, high-level delegates, and eminent professors from various countries across the world. Ladies and gentlemen, we are delighted and honored to host the third edition of the UNESCO MERCK Africa Research Summit, which will act as a platform to empower our youth in research and building human capacities of the future generation of African scientists through the organization of this workshop. This third edition of UNESCO MERCK Africa Research Summit will not only consolidate the cooperation between UNESCO and MERCK Foundation, but will also bring several states closer together to work for a better and brighter future. I have no doubt in my mind that this summit will be a worthwhile experience, and as we have the opportunity before us to learn from some of the best experts in the field of science and medicine, research, and technology. Ladies and gentlemen, one of the major themes of this conference is cancer. So if you allow me, I'm just going to say a few words on cancer. World cancer statistics are alarming. According to the World Health Organization, 8.8 million die from cancer each and every year, which is the second leading cause of death worldwide, and kills more people on the global scale than AIDS, malaria, and tuberculosis together. If the current trend are maintained, it is projected that the incidence and burden of cancer will rise from 14 million annually in 2012 to 22 million within the next 2 decades. In the Republic of Mauritius, cancer was the third cause of mortality in 2016, being responsible for 12.8% of death in the island of Mauritius and 11.4% of death in the island of Rodrigue. As per report of the National Cancer Registry, which was published only last week, there were, for a population of 1.2 million people here in Mauritius, there were 2,607 new cases of cancer in the year 2016. 1,058 among male and 1,549 among females. Compared to 2015, the total incidence of cancer has increased by 4.7%, with an increase of 10% in the female population and a slight decrease of 2.2% in the males. The 5 main sites of cancer in Mauritius are colorectal, prostate, lung, oral cavity, and bladder in male, breast, colorectal, cervical, ovarian, and endometrial in females. The pattern of cancer in Mauritius is different from, slightly actually, I must say, from those observed in most African countries, being more related to non-communicable disease risk factors, compared to other African countries where the risk factors are of an infectious nature, such as hepatitis C and HPV infection. My ministry has a comprehensive national cancer control policy comprising of prevention, screening for early diagnosis, treatment, and palliative care. In order to help address the risk factors of cancer, my ministry has taken major policy decisions and has developed well-formulated strategies, the salient one of which include regular public information and awareness campaign which focus on NCD, that is non-communicable disease, including cancer prevention and risk reduction, which are carried out at the level of the school, workplace, the youth centers, and the community. A structured screening program for women aged between 30 and 60 years of age for breast and cervical cancer is carried out at the work site and in the community. Women who show any abnormal sign on the Pap smears are referred to dedicated hospital for follow-up and necessary intervention. In the next few months, we are planning to start the screening for colorectal cancer as well. The vaccine against human papillomavirus has been introduced since last year for girls aged 9 years onwards. Free treatment is given to cancer patients, and about 200 patients attended for treatment and follow-up on a daily basis in the radiotherapy and oncology unit at Victoria Hospital, which is the main hospital that look after cancer here in Mauritius, while 90 to 100 patients are treated as inpatient. For therapy of cancer, a specialized equipment is in use. In order to provide optimum treatment to patients, my ministry is in the process of procuring 2 linear accelerators, which will eventually replace the existing one. Chemotherapy outpatient service has been decentralized and have been extended to 3 regional hospitals. We have 5 hospitals in Mauritius, so it's from 1 in Victoria and to 3 other hospitals. Palliative care for cancer treatment is provided through outpatient services and 2 dedicated wards at Victoria Hospital. It has recently been scaled up to 3 other regional hospitals as well. Personnel are now being trained to provide palliative care service in the community as well. The National Cancer Registry in Mauritius is one of the oldest population-based cancer registry in Africa. The National Cancer Registry collects data on cancer incidence and mortality, generating annual report, the data which has proved useful for assessing the impact of cancer on the community, formulating public policy for cancer control, and decision-making as regard to resource allocation. Cancer epidemiology and public health research is carried out at the Central Health Laboratory. My government is committed to the development of sustainable biomedical research on cancer. The ministry has structures and appropriate legislation to ensure that all biomedical research projects are ethical. Moreover, the Ministry of Health and Quality of Life collaborate fully with institutions such as the University of Mauritius and the Mauritius Research Council for the conduct of NCD-related research projects. My ministry has recently invested in high technology equipment to refine cancer diagnosis and treatment. A semi-automated Ventana equipment was purchased only last year for the Central Health Lab to allow subtyping of breast cancer cases as part of offering more precise diagnostic services. In Mauritius, all breast cancer cases and therapy are systematically screened for nuclear markers. Another development for cancer diagnosis has been an expansion in the list of circulating tumor markers offered by the Central Health Lab. To date, tests for 10 different tumor markers are offered in addition to hormone tests. The Central Health Lab is also involved in different aspects of vaccination as well. Post-vaccination monitoring by antibody assay for infections such as hepatitis B and measles. Serotyping of HPV virus to find the distribution pattern of HPV subtype prior to vaccination as part of the National Cancer Control Program. Annual serotyping of influenza virus to determine the prevalence of particular subtype for the following year's vaccination preparation. The virology department is recognized by the WHO and the CDC as a National Influenza Center, collaborating fully with a global FluNet project. In the current era of growing antimicrobial resistance, the government is now geared to supporting the introduction of studies to investigate resistance to certain antiviral. There is an ongoing collaboration with the International Atomic Energy Agency for capacity building for oncologists, physicists, and technicians in the latest technique for radiotherapy, chemotherapy, and up-to-date technology for cancer treatment. The government is investing in the new 238-bed cancer center with the state-of-the-art medical equipment and logistics. This project will include the construction of 2 bunkers with 2 multi-leaf collimators, linear accelerators, 3D stimulators, 3D treatment planning system, and accessories. An amount of 12 million USD have been provided under the Indian Financial Services for the equipment, and the construction of this center will be financed by the government. It is expected that the project will start early next year. In Mauritius, despite our limited means, a lot of work is being done on the different aspects of cancer, be it the preventive, early diagnosis, treatment, and palliative care. But I must admit, a lot of work needs to be done as well. That's why I think this conference, in collaboration with UNESCO and Merck's Foundation, will create the necessary momentum, which will enable us to provide better care for our patients suffering from cancer in Mauritius and also on the African continent. Ladies and gentlemen, before taking my seat on behalf of the government of Mauritius, I wish to thank UNESCO and Merck Foundation for the continued support in the development of science, and more specifically in the field of medicine on the African continent. Ladies and gentlemen, thank you very much for your attention.